the very first question is, how long have you been a nurse for? When did you first
Mm-hmm.
start working as a nurse?
So I've been a qualified nurse for now almost 3 years because I got my license in August 2018. So that would make it 3 years come this August. So I started working almost immediately, like 1 month later, I started working. So I worked in Kenya for a year, almost a year, then I came to the UK. So in total, I've been a nurse for 2 years and some months, which most have spent in the UK. Yeah.
Why the UK? What inspired you to come to the UK to practice your nursing here and not in Kenya or elsewhere?
The first reason and the most obvious reason for most people, including myself, was for better pay, because you find that the pay in Kenya for nurses is very, very little. So that was the first motivating factor. But apart from that, I wanted, the exposure to get to see how things are done in, should I say, the first world. So I wanted to see that exposure that we don't have in Kenya, because, in Kenya, because of the resources, most of the time, you don't have the right facilities. So I just wanted to have that experience of a properly equipped hospital, and see how the patient experience is, and my experience as a health worker would be as well.
Mm.
So yeah, and the adventure of it all, the adventure of traveling. Yeah.
So you became a nurse, and usually there's always an inspiration
Mm-hmm.
behind that. Did you come from a family of doctor, healthcare workers, or was it just a complete inspiration you got from somewhere that you just really wanted to be a nurse?
No, I don't come up from a family of healthcare workers. I'm the first one in my family anyway, and I'm also the last born, so probably the last in my nuclear family. My inspiration came in 2015. My dad was sick for a long period of time. So, when you constantly go to the hospital and interact with the doctors and the nurses and just see how everything is happening. And I also saw how they managed, because when he initially went to the hospital, it was a medical emergency. So, when you just see everything being done so fast and you see him improving because of that, I'd say like you see in the movies, although in the movies they exaggerate, but I kind of had that first experience of just seeing someone who was really sick and they do so much stuff and they start feeling better. So that is where I first got my inspiration to work in healthcare as a whole. So yeah, when I completed my high school, I was qualified to be a nurse. So it was an easy decision. I was just like, yes, I'm going to do this. Although I didn't have the full picture at the time, but that is where my inspiration to become a nurse started from. Yeah.
But why a nurse and not, let's say, a doctor?
I'd like to say it's because of, my qualification based on my high school exam. I couldn't manage to do medicine because of my marks, my grade. Then nursing was like the next best thing to it. Yeah. And so I opted to do nursing as opposed to pharmacy or other healthcare specialties, because when it comes to doctors and nurses, like they have the most patient contact, and that is what I wanted really. So that's why I opted for nursing. Yeah.
2 years in the UK working, 1 year
Mhm.
working, or maybe a few months working in Kenya. How has the experience been? How can you compare the two experiences?
Like the difference, oh my god, it's a huge difference. Like the difference is like day and night, I can say. So when I came to UK, the transition was really hard, to be honest. Like not only in terms of the workplace, but the culture, the weather, the food, the accents, people don't understand my accent. I don't understand their accent. So we had like that communication barrier in the beginning. But now in terms of the work, like I said, you know, the UK, they have different facilities, like totally different. And in Kenya, the facilities are limited. So, and when you come to the UK, they have a specific way of doing things. So we had to go through training all over again for every nursing procedure, like from the most basic nursing procedure you think about, which is like giving oral medication. They had to take us through their way of doing things, which is different from Kenya. Some in terms of some procedures, they are similar, but some procedures are different. So it's good they took us through that training period just to show us how they do things. And then now we started working on the ward. And the adjustment was really hard, to be honest. The first few months, I regretted my decision. I wanted to go back home, but you know, I hung in here. I hung in here, and it's been good now that I've adjusted. So I'd say,
what was the most difficult aspect of it? What is the most challenging aspect of the experience that really got you to a point where you said, I want to go back, or what the hell am I doing?
what the hell? So like I said, you've come to a new place. They have a totally different way of doing things. And you've not like really, like for me, it was the first time leaving Kenya. So it was my first time to interact with people from a totally different culture. So first, that communication barrier, you're in the ward, you're trying to talk to a patient, they can't hear what you're saying. So you start getting like those tiny frustrations, you know. So, and some of the procedures, the way of doing things is totally different. So I had to adjust in that sense as well. And then now, because work is hard, you're having, and something else, that the hours of shifts. In Kenya, we used to do shorter shifts, like 8-hour shifts. And then you come here, it's 12-hour shifts. So those were also really, really long for me, especially the day shift. They were just too long. But adjusting to that was also hard. So you find that you're really frustrated at work because it's not what you're used to. It's outside your comfort zone, you know. You're here, you think you know something, and then they come and tell you, no, this is not how we do this. This is how we do this. So that was hard. And then when you leave work, you are alone because, you know, I just came, I was on my own. So that loneliness, I'm missing home, I'm missing family. So those two combined made my first few months really hard. Yeah, that is what made me feel like I need to go back home. And to make it worse, I came in autumn, so winter was just coming in, and I'd never experienced winter, so it was just horrible. Because of both factors, like both work and out of work. Yeah.
And now, 2 years later, would you say it was worth it staying?
Yeah, it was totally worth it staying. Speaking now, like looking back a few months back, I wouldn't have thought it that way, but now I'm much stronger for it. Yeah. And I'm much more exposed, like I've been able to do so much. So looking back now, I feel it's totally worth it. Yeah.
And when you look at it just like totally again, looking at that experience, what are some of the moments, the key moments in your life that have happened in your experience in the UK? Be it, you know, interacting with the patients, be it people understanding your accent finally, or something like that. Is there one particular thing that just, you know, makes your heart melt or feel like this is what I like, this is why I'm a nurse?
Nursing or working in healthcare, it's like double-edged sword, because you have those moments when you feel really, really down, and then you have those moments when you feel this is why I do this, like this is for humanity. So I feel like I can't talk about that without talking about COVID, because just a few months after I'd come in, I'd started adjusting a bit now to the environment, to work. Then the pandemic started. So I can't talk about those moments without going through what happened with the pandemic, how it started, how it's been. Yeah, so
Well, let me just ask you that.
yeah,
So now you've arrived. It's been a year, and you are like,
yeah,
oh, can't wait for the summer to come. And then, boom, you hear, okay, so there's COVID, something called COVID, coronavirus, in
COVID.
happening in
Yeah,
Wuhan, in whatever.
China. Yeah,
Did you ever think that it would cross borders from China and arrive in the UK? And when it did, I mean, what was your reaction? Because this must have been a very scary moment, not just for you, but for your colleagues as well.
yeah. So initially, I remember, yeah, it was in the news and it was all over. COVID is in China, or something called COVID, there's a virus. Actually, it started like there's a virus happening in China. And at that time, you think it's not going to get here. It's not going to spread. I mean, China is so far away. And then it arrived in the UK. And at that point, you're also thinking it's not going to get here. It's not that big of a deal. It's not going to get here. So when in my hospital, when the numbers started coming up, we started panicking, but then you're still feeling like it's not that serious. It's not going to spread that fast. And I remember having this conversation because I remember I was on leave just when COVID was started. So when I went back to work, it is all everyone was talking about. And I remember having this conversation with my colleagues where we were like, this hospital needs to set up one specific ward for COVID, just to isolate patients. Why are they making up patients? And then I think a few days later we went to work, and we just walked into work and we found a lock on our ward. Like the ward was locked, no notice, no nothing. So it turns out they had decided that my ward was going to be the COVID ward. So, but still at that time, we didn't feel like it was serious. We thought it's going to be one ward. They're going to isolate the patients on that ward. And then, yeah, all is going to be well. So that was like the initial reaction. We didn't know it's going to last long. And even when the numbers started increasing, personally, I thought it would be a thing of 6 months and life would be back to normal. We would have managed it and life was going to be back to normal. At least that is what we thought at that time. Yeah.
Mm. Until it hit you hard and everything went into lockdown. So it's
Yeah.
been now just over a year, and you've been working hard. So what are those
Mm-hmm.
specific moments, the good, the bad, the strange, you know, that you've experienced so far during
Mm.
this COVID period?
Yeah, so it's been a lot. It's been a lot. So like I said, when it started, like everyone was confused. Even you could see Boris, the NHS, they didn't know what was happening. The hospital management, no one knew what to expect. So it was a case of trial and error for most part of it. So as nurses who are just on the front line, we were like really, really scared because we don't know what is going to happen. They keep changing the policies every day. They come up and say, this is what we're going to do today. The next day they come up and say, okay, no, scratch that. This is what we're going to do. So soon, like within, I think, the first 3 months, COVID had spread so much that the entire hospital where I work was like all COVID patients. So they started like categorizing them into those who are really sick, those who are not likely to recover, the young. So they did those categories. They did 5 categories. So we had the very sick who are in ITU. We had, so it depending with how sick you are to those 5 levels. And the 5th one was people who are now on end of life care. They have COVID and there's no chance for them recovering. So we started seeing, there was like a lot of death, like patients were dying almost every single day. And to make it worse was that lack lack of PPE, because they were only providing the proper PPE for those working in ITU. So the rest of us were just getting the basic, the mask. It wasn't even the FFP3 mask. It was just the normal mask and the apron. So you go to work and you're fearing, am I going to get this disease? But you have to work because you can't quit. So it started like that. There was a lot of panic and confusion. And I think, we gotten used to it a few months in, but now staff started getting sick. So patients are coming, but staff are getting sick. So we got really short-staffed. So anytime you go to work, you would be really, really overworked. And luckily for me, through the pandemic, I didn't get like symptoms for me not to work. So I've worked like through the entire pandemic. So that was like, it was now more psychological and physical toll on all the staff, but then you still have to go to work. So that was really hard to get through. But then with time, we gotten used to that. But for me, what was like now the hardest thing for me to go through was those phone calls we had to make. When COVID was happening, relatives are not allowed to come into the ward like we usually do, because usually when a patient is on end of life care, you ask the relative to come in, to be with the patient, to say their goodbyes, just to be with the patient in the last moments. But this was not happening. So the relatives would rely on our phone calls. So you'd be getting phone calls every time you're trying to do your work and you understand their panic. So you're trying to like give them the truth. So you hear like that heartbreak on the end of the phone call. And the worst phone call was just calling someone to tell them your dad has died, but you can't come in. So the body is going to go to the morgue and then, you have to follow up, but you can't come in. So for me, making those phone calls were the hardest, because sometimes you just hear silence on the other end and you don't know what to tell someone. You're thinking, what am I going to say? So you can't be overly comforting. You have to be, firm for them. You have to be like that strong person, but you're breaking down yourself. So that sort of suffering and seeing patients dying alone, that for me was the hardest part, dealing with the death of it all. And this is something that was happening on a daily basis. It wasn't like one death today and tomorrow. It was like 2 die today, like it was happening continuously. So that's like the bad of it. But on the good of it all, like there was a lot of solidarity with the NHS, people would bring us food, like we would never run out of warm food to eat during our shifts, and people were clapping. I remember there's a day the fire department and the police, they came and they organized like a huge parade for us, and lights and sirens. And it was just so heartwarming, coming from work and finding that. So that's been the pandemic through until now. So at this point, we've kind of gotten used to it. So yeah.
Would you say you are desensitized now in terms of like,
Yes.
like if somebody, let's say you see a death happening and you're just like, well, that's another just person who's died, so you don't feel like as time goes by, you feel less and less sad, and you just look at it as like, this is just part of life.
Yeah, that happens a lot in our profession. Like, not just for the COVID pandemic, but generally, like when I was a student or my first few months of work, I would get really, emotional and really connected with patients. And like you feel connect with the family, and you feel a lot of emotions when they pass away or they get, bad diagnosis. But with time, you can't keep on feeling that pain, so you try to cope with it, so you just put like a barrier to your emotions. So sometimes you look at a patient, you don't want to like get invested too much. But COVID for me, I think the worst part was seeing young people, because especially with the second wave, you'd see like 40-year-olds, 50-year-olds who just come in, they were walking, they were fine. And then a few days, they just start deteriorating. And before you know it, they're going to ITU. So that was like really, really painful. You know, you're trying to feel like this is someone with a family waiting for them, a husband waiting for them, and you don't know what is going to happen, and you have to talk to this husband. So those moments are still hard for me personally, especially giving that bad news that this is what has happened and your patient is not likely to come back. For me, that is still very hard. But for most of it, like, you try not to feel that pain. For instance, if it's an old person, you're like, okay, they've lived their life, so they deserve to go and rest. So you get desensitized, but at the same time, you come across those situations, like you look at the family situation, maybe they have kids, or maybe they had one kid or something that just makes you go back to, that humanity of it all and feeling that emotion. So in general, it happens, but you still come across those cases that just break your heart.
I mean, I'm pretty sure also, as much as you were, your heart was being broken, helping out and
Mm-hmm.
working in a hospital and, seeing families lose their members. On the other hand,
Mm-hmm.
you are the only child. You live miles and miles away from your parents. What the
Mm-hmm.
hell was going on through their minds? What were they thinking? I mean, they must have been so scared.
Yeah, like before COVID happened, I was planning a trip back home last year in June. So when COVID started, like I said, I thought, okay, in a few months, everything is going to be fine. And then I can go home, see my family. So I think for them, I shielded them from it all. I wasn't telling them how bad it was. Like, I was just telling them we are managing. Yeah, it's not that bad. Yeah, everything is going well. We are hopeful that everything will be fine. They're trying to find a cure. So I really shielded them from knowing like the reality of it all, the danger we were in. I lied, honestly, I lied to them that we have PPEs just to give them that peace of mind, because they were seeing how bad things were on the news. So I just tried to shield them from the reality. So I know they were worried, but I didn't give them the full picture. So had I given them the full picture, it would have been worse. So it was, yeah, it was like that. I shielded them from knowing the true the reality of what was happening. And for me also, I was worrying a lot because, my parents are old. My dad is old and he has all these comorbidities. So I started thinking about what happens if COVID gets to Kenya, and like I had seen how much resources was needed to manage COVID, because you find that like almost every patient on the ward needed oxygen, and having worked in Kenya, I know the reality. I know the reality of the matter. Most times, you don't have the most basics of things like oxygen, gloves. I know gloves. So I knew that if really COVID got to Kenya with the same intensity that it had in Europe, it would have like caused massive, massive disaster. So that was always my fear, that if COVID gets to Kenya, my family, they have like very limited chances of survival, because I saw the amount of resources it took to manage COVID. And I was thinking, the UK healthcare system is one of the best in the world, and it was overwhelmed. It was like really overwhelmed by COVID. So I was thinking about Kenya, and I just knew if it gets to Kenya, it's going to be like a disaster. So yeah, I always had that worry. Fortunately, it didn't get to that level in Kenya or in Africa as a whole. Yeah.
I'm sure you go back. I certainly do go back sometimes and ask because when it happened, I was actually in China when COVID first struck. I was in Beijing, and I felt
Mm-hmm.
I wasn't as scared, but a lot more people outside were scared. And then afterwards, after
Mm-hmm.
let's say a period of 4 months, everything started going back to normality in China, and it's like everywhere else it started going crazy. And then I had like these questions, a lot of what ifs, like what if. So when it was serious in China, I was like,
Mm-hmm.
okay, what if I was, at least I had gone home. And then when it's stopped
Yeah.
being in China and went everywhere else, I was like, what if I had left China? Because do you go back and
Mm-hmm.
ask
Yeah.
yourself, like, what if this happened and I was a nurse in Kenya? Do you ever go back? I mean, do you ever go into your thoughts and dig deeper on what this experience would have been like for you? I mean, obviously, you've given us an overview of what to expect in the Kenyan, healthcare system. But
Mm-hmm.
as a healthcare worker, do you sort of like wonder what would have been?
Yeah, like I think having that knowledge of the healthcare system makes me, yeah, feel like for me the biggest wonder is what if the pandemic gets as bad, and I keep thinking about it a lot. Like I kept thinking about that situation and I kept wondering because I know how the situation is in Kenya, but I've always kept in touch with my nurses who are my friends who are nurses in Kenya. So they kind of gave me the picture that was. So I think the most fortunate thing is that it didn't get as bad or as intense as it was in Europe. Because for me, that was my biggest what if. What if it gets to this level in Kenya? What if it gets to this level? Because I know if it had, even the healthcare workers, because just like I said, this is one of the best healthcare systems in the world, but they are short of PPEs, they're short of resources. And there's a time oxygen almost ran out of my hospital. So all these things I'm thinking, if they happened in Kenya, disaster. Like it's just going to be a massive, massive death toll. So that was my biggest what if. And yeah, for keeping in touch with my friends who are still working in Kenya, like it wasn't as bad because the cases were few, and even for patients who were there, they were not, as sick as most of the patients we saw here. Yeah, so for me, that's my biggest. It shouldn't get to that level, because if it did, then boom, disaster.
do you have
Yeah.
do you have one particular case, that it plays over and over, like every time you go to bed, and you can't stop thinking about that one patient or that scenario? So for me, one time I saw a report on the BBC, and I think this is when I realized the severity of it all, when they showed a case of a family stuck outside because there's no oxygen in an Italian hospital, and this mother, the matriarch of the family, was gasping for air. To me, that was like,
Mm-hmm.
until today, that picture still haunts me. Do you have those
Yeah.
moments, that one person, that one scenario that you can't get over?
Yeah. It's one particular patient, and like you said, it keeps, like, I remember her face to this date very clearly. And it was during the first wave, when the pandemic was just so intense. And during that first wave, they said mostly it was affecting the older population. So it was very hard to see a young person get to those levels of the sickness. So for me, it was this particular patient, and it was the first time. And she was sick, but not too sick initially when the shift began. Like she just needed oxygen, like just like 3 liters when the shift began. So she started like panting, and she was moving and she's restless. And in my head at first I thought she was exaggerating, because apart from that, she was this needy patients, for lack of a better word. Those patients who would be pressing the buzzer, nurse, come give me some water, nurse, can you move my pillow, nurse, can you? And then you sort of form you can't help it but form some judgment in your head, and you're like, this is such a needy person, you know. So when she started, you know, breathing so hard, I thought, oh, she's probably exaggerating, you know. And I remember I was in touch with the husband, because she was a young lady. She was like 39. So I was in touch with the husband, and he was really concerned. And I kept telling her, no, she's going to be fine, you know, something that you shouldn't say because you don't know what the future holds. And I learned a lot through the pandemic. So she kept you know. So I think eventually I was like, no, 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 she, even if she's pretending, I need to do something about it. Long story short, she left the ward straight for ITU. She was already, you know, getting to that level of unconsciousness. So for me, I was thinking, this is a 39-year-old, and what if I had not had that um, you know, sort of preconception that she might be exaggerating or she's just a needy person. And that haunted me. I didn't even want to try and find out what happened. You know, sometimes you like follow your patient, you go to the next ward to see what happened. Like, are they still alive? What is going on? So I think I didn't even want to know, because I didn't want to find out that she died. That would have like just broken. So I still wanted to date, and I still see her face, and I still see her the way, you know, she was making those movements. Yeah, so that is one patient that has really stuck with me, because she was young. And yeah, I feel like maybe I should have done something earlier on. I don't know. Yeah.
Or maybe there was nothing you would have done, but I'm pretty sure maybe
Yeah.
whatever she is, she's probably still alive, because she's young,
Yeah.
as you said. Now I've got a
Mm-hmm.
question. I mean, I'm sure you've gotten this before. I'm a huge fan of medical drama, like Grey's Anatomy
Yeah.
and whatnot. Is it really like
Mhm.
that? Is it really as glamorous as that?
Oh my God. Like, I'm also a huge fan. I mean, I've watched Scrubs, Grey's Anatomy, The
Yeah.
Good Doctor. So, oh, no, no, no. They make it so dramatic. Like, you don't get time for most of the things they have time to do, you know? In the movies, they have time to chat, they have time for hookups, they have time for all these things that don't really happen. Like, during your 12-hour shift, like you have so much to do in terms of patient care, you don't have time for the drama. So most of the times, like in terms of the conditions and the treatment, it's always right, but I think they usually just exaggerate sometimes. Yeah.
Pain, isn't it? It's all
Yeah, it's
pain.
it's all it's all exaggerations, you know.
Yeah.
And yeah, I think there's this medical drama for nursing. It's called Nurses, actually. I've not watched it, but I've seen
Have
a preview of it.
mm,
Yeah, and just from the preview, I was like, this never happens. This never happens. No, this is not true. This is not true. Yeah, so
yeah,
bits of truth in there, but they make it drama. They add just spice just to make it, Yeah.
yeah. So
Mhm.
my final question is, of course, you've been already been celebrating, Nurses Week. I saw that on your social media feed. So next Wednesday is
Yeah.
the International Day for Nurses. Do you have anything
Mhm.
special planned? And do you have some words to say to your to your fellow colleagues around the world?
Yeah, so what I didn't mention from the beginning of the interview, like I have a platform called World Class Nurse. I'm really passionate about mentoring other nurses and just making their experience much more better. So I create content around transitioning from school to work and transitioning from working in Africa to come to the UK for now. So last year, I started doing this last year. So last year I had sort of like had planned blogs, everything that I would share on those days, which I did. But this year, I don't know, it kind of got me as a surprise. I don't know. I think I've been working and my mind was just so focused on work. I didn't realize the Nurses Week is here. So in terms of now, I don't have any particular thing planned, but I've been doing like, I want to do a series of blogs between now and next week. I'm really trying to get them out there. Yeah, just to share some of my experiences of being a nurse, because for me, I think when I was a student nurse, I didn't get that, that sort of information from other nurses, just to know that it gets better, because it can be really hard dealing with all these things on your own, and you're not finding people who share, the same experience. So that is what I'll be doing between now and then, just releasing not many. I'm making it sound like it's a whole series, but probably one video and one blog post. Yeah,
And that's on your YouTube channel or on your website?
both. I usually try to do them both, like have both going, just for people who like to read, to have something. But for me, writing is like my first true love, should I say. So I feel most comfortable when I write, but video and everything about it, I'm just getting in there right now, and it's a bit scary. So for me, writing is that's what I feel most comfortable about. So I want to do a blog post on my first mistake, as a nurse, and just to let the nurses know that being a nurse is not being a superhero and being perfect. Because I think that is one thing that the media or people out there have made it appear like nurses are superheroes. So you have that mentality where you want to be perfect all the time. But it's impossible. We're just human as well. I wish they would say nurses are human too, because that's the reality. So nurses should learn to take a break when you're feeling overwhelmed, make mistakes and know that it's okay, it happens. Although our mistakes, they are not like other mistakes, because you're dealing with human life, but at the same time you will make mistakes. So for me, that is like my message. I'm centering, I'm focusing on that for the next period of the Nurses Week, until Wednesday, just to let nurses know you're human and you need to take a break. Like, take a break if you're feeling overwhelmed. You don't have to be a superhero. Yeah.
Cool.